Hello, everyone. We're back. And in this set of lectures, we're going to be talking about coding endocrine, nutritional, metabolic diseases, and diseases of the immune system. These codes all begin with E as an endocrine and include areas like diabetes and other endocrine disorders, things like the thyroid, obesity, dehydration, but also things we don't always think about, post-procedural endocrine and metabolic disorders, obesity, and other things. Let's start with diabetes, one of the more common ones that we see in primary care. Diabetes codes are combination codes. These combination codes include the type of diabetes, whether it's type 1, type 2, the body system affected, and the complication. Many times diabetics will have more than one different type of complication. They'll have retinopathy, neuropathy, renal manifestations. And if that's the case, we would use as many codes as required to code all these different complications. We always think of diabetes as type 1, type 2, juvenile and adult, and which we'll get into in a little bit. But sometimes we get diabetes secondary to an underlying condition, right? Something going on and impacting the pancreas, for example. In that case, we use a code from the code category E08, diabetes mellitus due to underlying condition. And per the tabular, we would code the underlying condition and use any additional code to identify any insulin use. We'll talk more about that and the importance of it. With E09, we can have drug or chemical-induced diabetes mellitus. This could be secondary to medications such as prednisone. So if this is the case, we would code this as a poisoning due to a drug or toxin, if applicable, and use an additional code for adverse effect to identify the drug. We'll get into this a little bit and talk more about poisoning and adverse effects in lectures to come. We'll also use additional codes to identify any insulin use, which gets us to the last sentence of this slide. With E13, other specified diabetes, we'll cover a whole bunch of those, and we'll get into those in a little bit. We would also use additional codes to identify how the diabetes is controlled using insulin, the Z79.4, the oral anti-diabetic drugs that many of us are familiar with, the Z79.84, or any oral hypoglycemic drugs, the Z79.84. And again, we always need to code these as additional codes. These are something that we always should pick up when we're coding diabetes. Disorders of the thyroid gland fall into code categories E003, E07. You can review figure 7.1 for the different endocrine organs, but basically it's pretty straightforward. You need to read the documentation and act accordingly. Hypothyroidism is a decreased production of the thyroid. And again, that would be the main term that you would look at. The goiter is a term for the enlargement of the thyroid gland. And there's several different subtypes of this, the toxic goiter, cystic fibrosis, or fibrosis, what have you. And again, the key here to getting the correct code is to look at the documentation. Thyroid toxicosis is excess thyroid. So in other words, we have too much of it, right? And again, that would be the main term that we would look at in the alphabetic index. Thyroiditis is the inflammation, itis meaning inflammation, and this can be caused by a variety of things, a viral or bacterial infection, autoimmune disorders, and other reasons. There are basically 5 categories of diabetes. And basically diabetes is the global term used for the condition where the pancreas does not produce insulin normally. And there, again, as we talked about, combination codes that talk about the different manifestations and complications. These follow to the right of the period using the fourth and fifth characters. And again, we would report uncontrolled diabetes status by using the code for diabetes by the type with hyperglycemia. And there are different reasons why people are diabetic. It can be both hereditary in the case of type 1 or non-hereditary, type 2 generally. And when we're diabetic, we don't break down enough sugar. And so basically it's not broken down effectively, and the sugar as a result accumulates in the blood, spills into the urine, and this is what causes problems. And again, with high blood sugar, we have diseases of not only the cardiovascular system, but retinopathy, meaning the eyes, the retina, kidneys, neuropathy, gums, teeth, and other manifestations. Here are 5 categories that we talked about, and they are as follows. E08 is for diabetes that is due to underlying condition. E09, drug or chemical induced diabetes. Then we have E10, type 1. E11, type 2, the much more common type. And E13, other specified diabetes. Type 1, we used to refer to as juvenile diabetes, but now that term is falling out of favor, and we call it type 1. Type 1 is usually diagnosed in children and young adults, and in this case, the body doesn't produce enough insulin. This is roughly 5% of all the people who have diabetes. So it is congenital and usually something congenital with the pancreas where not enough insulin is being produced. Type 2, on the other hand, is more common, and basically the cells basically ignore the insulin or they don't use the insulin well. Patients are usually older, meaning adults, they're obese, and they have a family history. However, we are seeing more of type 2 diabetics in children recently. With diabetes, they have frequent infections, blurred vision, cuts and bruises that don't heal quickly. And then we also have wound healing issues and numbness in the hands and feet. When we have diabetes that are due to an underlying condition, such as some of the things we see here in this set of bullet points, the rubella, Cushing syndrome, cystic fibrosis, malignant neoplasm, and others, we would code that first, right? So these things would come first, followed by the E08. So code first means that's what comes first. And then again, if they're being controlled with insulin, anti-diabetic drugs, oral hypoglycemic drugs, we would use something from the Z79 code category. There's some important excludes notes in this. So again, another example of why we always want to validate with the tabular. Drug or chemical induced diabetes, we will see in the tabular code first. So we'd code first the poisoning due to the drug or toxin, if applicable. That would be a code from category T36 through T65. And the 5th and 6th character would be 1 through 4 or 6. Then we'd use an additional code for the adverse effect, if applicable, to identify the drug with a 5th or 6th character of 5. Then we'd use an additional code from this code category Z79 for the anti-diabetic medication, be it insulin, the oral drugs, oral hypoglycemic drugs, what have you. And that's all I have for you. Come back for the next video lecture where we'll talk more about diabetes.